All right, I think we have a quorum, so we can begin. Cold day. We have some of our colleagues that will be late joining us. I think that the Mayor Pro Tem said she'd be here about 9:30ish. I think Councilmember Alter anticipated to be here 10:30 or 11 in that time frame. The others we've either heard from and going to be here about now. Councilmember Harper Madison is not going to be with us today. Today is Tuesday, November 12th, 2019. It is 9:08, and this is our work session here in the Boards and Commission room at City Hall. I want to start by thanking the clerk's office, which has managed to open us today and here on time after staying really late last night at the Planning Commission meeting. Heading home in not altogether great conditions, coming back early today in not great conditions. So to the clerk's office, everybody in the office, I want to say thank you for going above and beyond. We're going to start today with a presentation on homelessness. So we can go, and I think that we will lose Matt Mollica at about 10. So we'll push this presentation forward and make sure that we hear from Matt before 10 o'clock. Rodney.
Thank you, Mayor. Good morning. Rodney Gonzalez, Assistant City Manager. Today's briefing is going to cover several topics. First, we're going to go over the Guided Path Pilot project update. We've been posting updates weekly to our website. Then we're going to bring up Matt Mollica, as you mentioned, Mayor, the Director from Ending Community Homelessness Coalition, to talk about the encampment strategy that we are proposing, utilizing motels as immediate housing units. Then we're going to have representatives from Integral Care, Ellen Richards and Darylyn Cardona-Byler, to talk about Integral Care's role in service providing. They are the local mental health authority. Then we're going to have Director Ken Snipes come up and talk about cleanups and storage and provide an overview of the services in that regard and some recent changes to increase cleanups. Lori Pompeo-Harris is not with us this morning. She is out sick, so I'm going to go over the Guided Path Pilot project. Just as a quick reminder to the public, Lori is still our permanent homeless strategy officer. We did indicate that she will be transitioning to a consulting role. That has not occurred yet. However, she is still a permanent employee of the City of Austin and is our homeless strategy officer. As a reminder for the public, the Guided Path Pilot Project was developed by the Homeless Strategy Office in concert with numerous city departments and external partner agencies. It was a strategy designed to address the encampments outside of the Austin Resource Center for the Homelessness. There are 3 phases to the Guided Path Pilot Project. First is outreach and assessment. That was completed. Then service engagement and referral. That has been mostly completed, but as you will see, the individuals that have been contacted, we continue to refer them to various services across the community. And the 3rd phase is sustainment and accountability, which is underway, and that includes monitoring by the Austin Police Department as well as cleanups in the area. As to the results, we've had the pilot project underway for 3 weeks now, so you've seen updates on October 28th, November 5th, and then as of yesterday, November 11th. In terms of the number of individuals housed, 9 of the 99 who have been contacted have been housed. 2 were reunited with family members. 79 individuals have been enrolled or referred to enrollment to Housing First programs. 23 have not been matched due to lack of resources. Just as a point of reference, we started with 24, so that number we hope to, of course, gradually reduce. And 13 have accepted respite care. So we've had some good success with Guided Path Pilot Project. I can't thank the city departments and our partner agencies enough for their support in the Guided Path Pilot Project. And next, we'll bring up Matt Mollica. We're going to talk about utilizing motels as part of our encampment strategy.
Mayor?
Yes.
If I have a quick question, should I ask now or wait?
Why don't you wait? Let's keep going.
Okay.
And that way we will make sure that we have Matt out here by 10.
Mayor and Council, you may recall that in previous memos and previous presentation on October 29th, we talked about an encampment strategy that we want to move forward with. The key to the success of that encampment strategy is identifying immediate housing units that we can locate individuals to, and these would be low barrier or no barrier units in most cases. We believe that motels are the key to that immediate housing unit. This Thursday on Council's agenda is an item for consideration for utilizing motels. You may recall, Mayor and Council, that previously we had talked about the South Austin Housing Center. There are a number of reasons why we want to use motels. They're both the same strategy, but the motels have an immediate aspect to them in that we can use them right away. And what we're bringing forward is a partnership with ECHO. ECHO is aligning various community partners, philanthropists, if you will, to help support the operations and maintenance and to stand these facilities up. The motel that we're looking at is in South Austin. It's approximately at Altorf and 35. It would be 87 units, I believe. It is our intention, of course, that this is the start of that process, and we would continue to, of course, make acquisitions like this in the near future. I'm going to turn it over to Matt so that way he can explain more about the encampment strategy, in particular utilizing motels as immediate housing units. It's something that Matt has done successfully in Denver as well.
Thanks, Rodney. Good morning, Council. So I'm happy to provide a short overview, then answer any questions that y'all might have. So one thing that's been consistent when we've talked to people experiencing homelessness in a lot of the camps around Austin was their desire to be inside, and we asked specifically about hotels as a gateway and a pathway to providing shelter and support to those folks. And we almost unanimously, 100% of the folks that we spoke to, said that they would take a hotel room, and that hotels are preferable for them from a privacy perspective and a space perspective in terms of getting inside. This, as Rodney said, this strategy I've used throughout my career in San Francisco and in Denver. We've used it to provide immediate an increase in the housing stock in certain communities. So, there's a lot of other ways that communities have gone about purchasing new units to provide permanent supportive housing or interim or bridge housing, like we're talking about. Hotels are one strategy that doesn't cannibalize existing housing stock. So we're not buying or purchasing an apartment complex that might otherwise be affordable for folks that provide income or provide rents that are low or that have voucher holders in there already. These are new units and new housing stock that didn't exist in the community before, and it's a very well-established strategy across the country. So I'm happy to answer any questions or talk a little more about sort of how, what our strategy to attack this acquisition is.
Okay, yeah.
Thank you. So I really appreciate the work that ECHO's doing in partnership with the city and with many others. And so, and having the benefit of what you've seen in other places is very helpful. So it makes a lot of sense to use motels. They're already configured in a way that you don't have to change the building. If that alone is very, very useful, I think. So let me just ask a few questions. So, we've talked a lot about, I'm not sure if I'm going to use the same terms that you think of it, but we've talked in terms of like a path to housing, a housing first, which I think is different. But basically what we've talked about is the importance of when we find places for people to stay immediately, that we also connect them to services so that they also have a path to more permanent housing, whatever that is for them. Mm-hmm. So when you are thinking in terms of standing up these motels as a place for people to stay, talk to me about what you're thinking in terms of that connection to more permanent housing and to social services or healthcare or other services like that.
Sure. So I think, crucial to the success of something like this is the supportive services that can be provided in the physical location of, the hotel. And so I think, there are some very critical services that are needed for folks experiencing homelessness that are in vulnerable situations coming off the street. Mainly, we're looking at needing to bring healthcare services, primary care, some specialty care, some psychiatric care to them, case management, clinical case management, substance treatment counseling. And so that all of those things will be provided on site for folks experiencing homelessness there. And so the idea would be that we'd be able to set up an area and provide space there for service providers to come, see their clients there, bring them down to see primary care and get other services on the spot right there. And I also think it's important to recognize that we're going to provide this space for folks, to start on these 81 or 87 units. I'm unsure what, I think it's 81 units. And folks will be able to stay there for as long as they desire to. And I think that's an important distinction to make. So if we have somebody there that's waiting for another resource and we're able to say, here's a rapid rehousing voucher, here's a permanent supportive housing voucher in the community, let's get you stabilized, get you connected to your case management, and then move you out into the community, we'll be able to move somebody else in behind that person. There will be some folks, I don't know what percentage of people that will be, that will identify this hotel as something that they think is a long-term solution to end their homelessness. And we need to be able to be flexible and allow for that to be the case. And so we can turn those units into permanent supportive housing units down the line. But what we've seen in other communities is that average length of stays for projects like this are around 90 days. So you can imagine if 80 folks are staying for an average of 90 days, then you're cycling about every room is being turned over 4 times. That's approximately 300. I'm doing math on the spot here. 320 units or 320 households being served through this one hotel annually potentially, and there's an impact there that can be really large, and can scale up to serve lots of people experiencing homelessness in this community. I think another thing to be really clear about, which you mentioned, is we're going to be serving some of the most vulnerable people experiencing homelessness in our community in these units. And the reason we're going to have very low barrier, we're not going to require any sort of background check for entry, we're not going to require any money up front, we're not going to require a housing plan up front. We're going to get people inside and then bring the supportive services to their front door, to their door, and every day, over and over again, and ask, are you ready now? Are you ready to engage in your health care and your primary care and your case management, and offer those services to them in that space while they're healing and off the street.
So you'll be working, I'll just ask a few more questions and then let others. So you'll be working with social service agencies in the community?
Yeah, so ECHO is going to work to raise operating and service dollar funds for the first 2 years that the hotel will be in existence, like operating. And then it's the belief that we'll be able to then bring in revenue from other sources to operate the hotels long term. And so, yeah, we'll be RFPing out or request for proposals to social service agencies to provide the types of services I listed before in those hotels.
Okay, then I just have 2 last questions for now. Then, so folks are referred to you. Folks will be referred. Mm-hmm. And so they may be referred by social service folks, they may be part of the guided path kind of program, or some other encampment response strategy program. So there's a range of ways in which they may come to this location. Is that right?
Yeah, I think one of the things we're going to have, obviously 80 units, 81 units, 87 units, not enough to serve all the unsheltered population and people experiencing homelessness in this community. We're going to have to create very focused referral pathways that are easy to define for people in the community, for both the service providers and the people experiencing homelessness. How do you get referred into these programs? Because there won't be enough units to serve everyone that needs to be served or wants to be served through this mechanism. So I think there will be a combination of people on our coordinated entry wait list. It will be a combination of people in the camps. It will be a combination of people in the shelter system that need this sort of service. And so I think we're looking at a broad, sort of wide range of referral pathways that will have to be defined and I think we'll need to bring our community partners to the table to determine what some of those best pathways are.
Okay, last question then. So, and this is for Rodney, I believe, perhaps. I think I'm understanding that our staff is continuing to look for available motels. Is that right? Because
Yes.
it sounds like this is. Can you speak to that a bit, or?
Absolutely, and because there are real estate transactions tied to this, I believe we have an executive session item that we
Okay.
could also answer some more questions in that regard.
Okay.
But obviously, 81 units is a good number. We feel that we need more, though, to adequately address the total number of individuals experiencing unsheltered homelessness in Austin. And so it's something that we are pursuing consistently.
Okay, thank you. I'll have more questions later, but let me.
Okay. I have some questions, so I'll start here and then pass it on. So the hotel that we're thinking about that's up for consideration this week is one that's going. The city would initially purchase this, and then the Echo would operate it. I understand you'll bring in services. Is that correct?
Yes.
Okay. Matt, does Echo or you have any experience operating motels?
Sure. So Echo, I don't believe has experience operating hotels. I have experience in other communities operating these hotels at both the Colorado Coalition for the Homeless and through our San Francisco Department of Public Health Direct Access to Housing program in the city of San Francisco. There was a partnership between the Tenderloin Neighborhood Development Corporation, the Department of Public Health, the Housing and Urban Health Clinic, and some social service providers where there were single-room occupancy hotels in the Tenderloin that were being renovated and provided to people that were accessing the emergency services, mainly the Housing and Urban Health Clinic through the Safety Net Hospital, San Francisco General.
Okay. And you've had experience operating these, and have they been successful in your past?
So yeah, I mean, I think what we found is that this type of housing is has been identified by people experiencing homelessness as a desirable sort of transition off of the street, and they've been successful because we take into account what people experiencing homelessness want in their housing situation and what they desire, and so that this. Time after time, we operated one in Denver, Colorado called the Gateway Inn and Suites, and that was eventually over time created was the actual hotel was torn down and 112 units of permanent supportive housing was built on the site. Beautiful units for families and individuals, and so yes, we've done this in many communities. It's been done across the country in communities I haven't been a part of, and it is a successful homeless response strategy.
Is there an estimate on how quickly we would be able to stand up this particular motel?
Sure. So as far as the contracting goes, once it's bought and the city takes over ownership, I think in the days and weeks leading up to that, we're going to have to look at because it is a hotel who's staying there and how what kind of reservations are pushed out for a period of time, if we can accommodate folks and other, if they can find other accommodations for that. But I think, it has an immediate impact. The units are ready for occupancy, and until the money's raised to have it run smoothly and fluidly through Echo, I believe, and I'd imagine after talking to service providers in the community, there'd still be a desire to use the space for folks who are in existing programs that are homeless on the street, experiencing homelessness. And so I think, we have Integral Care here today, but after talking with Caritas, Front Steps, Integral Care, there are people that could access these spaces immediately and services connected to them to be able to provide it in the space. So
Okay.
I think that it's an immediate impact.
It's good to hear. So even if we are, entering into a purchase, we're in a diligence period of time and getting ready to go, the fact that we're exploring actually using the rooms now to the degree that we can, I think, is important. We continue to look at other motels, and I think that that's a really good thing, hopefully in other parts of the city too, to the degree to which we're able to do that. Do we also have people that are continuing, in addition to the motels, we have some people that are not as challenging sometimes to find places for, that that can more readily move into apartments or into other rapid rehousing situations. Are we continuing to do that? Who's leading the effort on continuing to increase those numbers?
Yeah, so it's an important thing to mention is that none of this, these hotels aren't, bringing the hotel units on it's not creating a, it's not happening in a vacuum. These things are all being built into the larger homeless response system. And so, of course, yes, we're still housing folks, certainly through our COC funds, our continuum of care funds that are federal dollars, into our rapid rehousing, permanent supportive housing programs. The city dollars right now are dedicated to the Guided Path pilot project. My understanding, Rodney provided an update into that project earlier. Folks are still being housed through those means now, and that won't stop while we wait while we bring in the hotels into the fold.
Okay.
Yeah.
You talk about the cost. There's a cost to purchase it. I guess it would have to take a look and see whether there's a cost to renovate. And then just to daylight, there's some discussion about if some of these units would be long-term permanent supportive housing, bringing in kind of a kitchen aspect to it. Could you talk about that?
Yeah, sure. So I don't believe that. And I don't believe that there's any cost to renovate to move in immediately for the bridge housing purposes. As we look down the line to create permanent supportive housing out of these units, one of the things that's needed, that will be needed, is a sink, and this is a very sort of technical thing, but a sink in the kitchenette area, because in order to use housing vouchers, federal dollars, for this, you can't have only one sink in the bathroom. You can't wash your dishes in a bathroom sink. That doesn't pass what's called the housing quality inspection standard, so HQS inspections, and so we're going to have to put sinks, little kitchenette sinks, into the spaces near the refrigerators and microwaves in these units in order to use housing vouchers, which long term will be used to pay the operating dollars to stand up the hotel free of needing to raise that money.
Okay. And we had talked about the people that would be able to take advantage of the opportunity in this property. Would those be people that were then referred by ECHO or social service agencies, or come off the priority list or the Guided Path project list, as opposed to people just walking up and showing up and asking to come in?
Yeah, so we'll you won't be accessing the hotel at the site. The referral pathways for access into the units will need to be established by really ECHO would be listening to the service providers around what some of the best ways to allow for those referrals to come through, and where are some of the best ways to get referrals. I also think we've seen over time that in other cities and other communities that this is a good opportunity to really engage some other institutions, whether it be the healthcare institution or the criminal justice institution, around being able to discharge folks immediately into housing instead of having them discharged to the street and utilize their emergency rooms or emergency services over and over again, or be hit the jail systems over and over again. So I think as we start to scale this up, there will be some engagement needed. ECHO will be engaging those systems, and we are creating jobs within our organization to engage those systems on hopefully paying for beds in some of these hotels to stand up the operating costs long term, so they can have spaces to discharge folks to who are experiencing homelessness and are utilizing their systems on a high level. So there will be a lot of different referral pathways. Some come from the service providers, some come from larger institutions, some will come from the coordinated entry system. And I think that the variety of referral pathways is crucial to being able to operate these long-term in a flexible way that allows us to meet the need of people experiencing homelessness in our community.
So unless and until there's a better option, in a better geography, one of the things you're going to be taking a look at is whether we could create, say, respite bed or opportunities in a
yeah, I think respite's been identified as a need by a lot of service providers and the healthcare institutions in our community as something that we could really use more of. And I think that hotels are used as respite in other communities. They work really well. Phoenix has a great model for that, and there's others that have used hotels and motels as respite.
And I understand, I mean, I recall that from the ordinance that the city council passed, there's the opportunity, or at least the allowance for the city manager to identify an area around a facility like this to help ensure that they're not seen or perceived as being difficult in an environment. And I would hope that you'd be advising, among the group, advising the manager on making that decision at his discretion.
So I'll also say, in Denver, Colorado, and the last time the last space that this was done was in a Quality Inn and Suites in Stapleton. If people are familiar with Denver, the Stapleton neighborhood's a very well-established, new neighborhood now that there isn't a lot of permanent supportive housing happening there, and this was integrated smoothly into that community with no issue.
Okay. And you were looking at, we had the ordinance we passed, and there was a set area that was defined around the arch, and then there was an allowance on other shelters. Is this something that possibly could be considered? I guess you'll take a look at that in your discretion and see whether or not it fits within that. I'm wrapping up here. The numbers that were given on the guided path, and while I have you here, I just want to talk about numbers. And my hope is that you all are developing a dashboard that we can be looking at here weekly to be able to compare week to week that goes beyond these numbers. I'd be interested in knowing how we're doing on the coordinated entry wait list. Are the people in that list going up? Are we moving people off of that list so that this community on a week-to-week basis can compare numbers from one week to the next week, which means also presenting the numbers in a form. I know that you've given us a memo over the last couple of weeks. I don't know if we're getting another memo today, because we had talked about finalizing the numbers on Friday, which would mean we would get a memo either yesterday or today that would give us an update in each of those areas, but to get to some kind of regular reporting form so that it's easier to compare where we are week to week, broader than this.
Absolutely, Mayor. And at the conclusion of all these briefings, we're going to open up the floor to general questions for each of our priority area leads. Laura Foss is here. She's our priority area lead for communications, and she can talk to you about the work that's being done to create an initial dashboard on our website to do just what you're talking about, to post not just the guided path information, but information that would come from ECHO. We've been talking about the more broader general information of number of individuals housed and served, et cetera, and posting that information weekly so that way the community can see the good work that is being done, not just by the city departments, but by our partner agencies.
There would also be potentially, we could talk about that later, the status and movement on that coordinated entry wait list, the number of rooms that are available in the city and what kind of rooms they are, kind of thing, so we can keep track of that. I know that when we were successful with the veterans, we were keeping track and soliciting apartment association to help us, and they were great partners on this, apartment managers to do that. We were keeping track of the rooms that were going up. We were creating the risk fund balance, even reporting on that dashboard what the balance was of the risk fund in case people wanted to participate and contribute to that. Might be another data point, but we can talk about that when that person comes up. The numbers overall is what I want to conclude with. We said at the last meeting that we had successfully housed or exited from homelessness, I think like 500 people since August. And it's really important for the community to see that while all these discussions are going on, that the city and the service providers in this community are actively engaged in this work and continue to be. And that we're housing people or exiting people to the tune of about 170 people a month. But we were also doing that prior to August as well. But there's always going to be a limit to how many people we can exit until we start building a greater capacity at the end of the time. But the numbers are still not clear to the community. We had 2,255 people at a point in time on one given day or night. How many people were experiencing homelessness in shelters or not? But over the course of the year, my understanding is there are about 7,500 people that intersect with our system that may be showing up as experiencing homelessness and are housed or exited, and that number would never be show up on that given night when there's a census because they entered homelessness and left homelessness at other periods of time. So there's like a bigger number that's 7,500, and then I understand there's another number that's like 12,000 or 14,000 of people. Can you talk about the numbers?
So it's difficult. The point-in-time count is an annual count that HUD requires continuums of care to complete in order to receive funding. It's HUD's way of trying to better understand the scope of homelessness in communities. As you can imagine, it's a count. It's a physical count of people experiencing homelessness on one night in January, and it relies. ECHO is in charge of coordinating that count, and it takes a lot of volunteers. We have almost 80 volunteers that fan out across the city and have to physically count and get somebody to fill out a survey in order to be counted for the point-in-time count. So when you talk about 2,250 people experiencing homelessness in our community on one night in January, the 24th, I believe it was last year, that night being able to be found and be counted is a lot different than how many folks are experiencing homelessness in our community that are touching our coordinated entry system and are a running tally of people experiencing homelessness throughout the year. So right now we have a list of folks in our coordinated entry system that is, around 7,500 people that our coordinated entry system has identified as experiencing homelessness in Austin Travis County. That is obviously a larger number than what we were able to count in one night in January in terms of finding those folks and be able to physically count them. So the discrepancy there is that we have folks who are on that coordinated entry list that hit that list at some point during the year that haven't resolved their homeless situation that we know of to date. And of course, we don't have enough capacity in our community to track every single one of those 5,500 people and exit them out of our homeless management information system if they've self-resolved and haven't resolved through one of our housing programs. And so right now, the data, it's difficult to sort of put your arms around exactly the number of people experiencing homelessness here in Austin Travis County. It's my opinion that it's closer to our coordinated entry number and not as close to our point-in-time count number. So I think we're somewhere between the 2,250 and the 7,500. And I think we're doing a better job of being able to count folks on the point-in-time level and getting people out of our coordinated entry system that are no longer homeless, experiencing homelessness. But those two things are difficult to manage when we have our service provider community is doing a lot of work with folks and are stretched pretty thin already. So I think that's the answer on the numbers. It's complicated, and we need to be able to provide. I think HUD is moving away from using the point-in-time count potentially as a way to count people experiencing homelessness in your community. I think there's some discussion that in the next year to 2 years that won't be something that's used to measure need in communities, and we will be using a by-name coordinated entry list, which I think is a lot more effective and should help lessen the confusion in communities, and that's the hope.
Okay. I want to say that I'm real appreciative of staff and ECHO and everybody that's been involved in trying to find the additional capacity in our system for housing and this motel strategy that we'll consider this week. I'm just really thankful to see it. My sense is that with this we begin to turn the corner on dealing with this challenge insofar as it's putting us on the right path to be able to increase capacity, which ultimately is something that we need. I think it would be helpful if you could take a look at the motel strategy and come back to the council and talk to us about how that number fits in context with what we're doing. I mean, are we looking to get 300 motel rooms or 500 motel rooms or 800 motel rooms? What is the capacity of our system, capacity of ECHO, capacity? What are we hoping for? What is the goal in this city so that the community knows what it is that we're trying to achieve over what period of time? I think would be very helpful.
Yeah, so ECHO is looking at putting together, with help from the service provider community, potentially 3 to 5 year plan on what type of permanent supportive housing is needed in this community and how we could get to that number.
And then the last question, I promise, is what the state is doing and what the chamber doing inconsistent with the strategy that we're focusing on here with the motels?
So I think I think what the state's doing and what the chamber is doing is outside of where I would spend my first dollar in terms of if I was getting into this work, or if I was starting to create or add on to the homeless response system. The state right now, is just providing space for people to be. And if they've talked to people experiencing homelessness in the community and that's what they've identified as what they need, then I think you'll see people using that space. If they haven't talked with people experiencing homelessness or talked with service providers about whether or not this is something that'll work for the community, then you'll see that it won't be used to
My question is, it's not what the state's doing, what the chamber's doing, it's not inconsistent with this strategy.
It's just
if someone wants to come off the streets and be in either of those locations, it may be safer or healthier for someone to be there than to be out at a river or a creek.
Sure.
It's not inconsistent
Yeah.
with what it is that we're doing.
No, I would agree with that. I think, yes, I would agree with that.
And the providing the housing might actually make those more successful if people knew that they had the ability to go somewhere and then were going to be pulled out into a permanent supportive housing situation.
I think what it doesn't do is address the long-term need for permanent supportive housing in as an answer to ending homelessness in our community. That's the difference. Is we're providing more emergency support for people through those mechanisms, but
Right.
there's no flow for those people to exit that emergency support without more investment in permanent supportive housing options.
Okay, thank you. Kathy and then Leslie.
Thanks very much. Apologies for coming in a bit late. As maybe the mayor mentioned, I think the school delay is impacting several of us on the dais. So I have some questions. As I understand it, we did the guided path pilot project update, so I have a few questions about that first, and then some about the hotel. So these are cumulative numbers, I assume, but it was less clear to me whether individuals not matched due to lack of resources is also intended to be cumulative. So are we looking at 24 plus 23 plus 23 individuals, or is the number 23?
So it's the total numbers of people enrolled, or the 75 plus the 24. If you look at the October 28th column, so that's 79. There were, I think, 3 more people that have been enrolled since then. So now you're looking at 102 that have been enrolled. And of those numbers, 13 had accepted respite, 9 were housed, and 2 were reunited with their families. The other information about the individuals that have been enrolled, I think we're still trying to identify ultimately their path, if you will.
Okay.
But the numbers that we're looking at are those 2 rows that are individuals enrolled or referred to enrollment and individuals not matched due to lack of resources.
I see. Thank you for that explanation. What are some of the resources that are lacking? I assume housing is primary among them. Are there other resources that are lacking?
Sure. Right now, I think what you're looking at for not matched is either there's not enough capacity within the social service or the service organizations to take on additional people experiencing homelessness, so their caseloads are to the point where, they're extended beyond. You don't ever want to be extended beyond effectiveness. So if one case manager's capacity to serve, and I'm making this up, is 20 individuals, and you try to enroll 25, well, then the care of all the 20 individuals is compromised from that perspective. And so there's some capacity on the case management service provider end, and there's also obvious capacity on the rental assistance, being able to provide the actual housing subsidy to people experiencing homelessness in that space. There's also a mismatch of resources that Lori Pompilo-Harris talked about before around we're using some rapid rehousing dollars right now to serve people who need permanent supportive housing. So that's not something that's indicated in this chart, but that's also something to keep in mind.
So that wouldn't be reflected in the 23, but it might be reflected in 79, or is that strictly, are those individuals enrolled or referred to
So the 23
referred to enrollment in housing first?
Yeah, so the 23 individuals are ones that have not been identified for any case management resource or housing assistance resource because of the lack of resources. Within the 79, you have people enrolled in rapid rehousing projects that probably need or have been identified as needing permanent supportive housing as their intervention. So there's also a gap there that exists within the 79 that's not called out in the 23, if that makes sense.
Got it. So they may not be referred to enrollment for a Housing First program. They may actually be receiving rapid rehousing dollars and be waiting for resources to be identified for a Housing First program.
So the definition of the Housing First program in this case is just that they've been the Housing First program is the case management resource they've been identified to have, and that comes along with a rental assistance subsidy that may or may not they might not have the funding to use the rental assistance within that 79, if that makes sense. They're being case managed, but there's not rental assistance funding behind it to house them. So they're receiving case management. And so you can still be in a case management service. And I know Housing First is a misnomer because it doesn't.
Yeah.
There are Housing First service programs that don't we're not talking about actual rental assistance dollars and bricks and mortar housing with it.
I think that we need more clarity around the 79, around among that 79, how many are enrolled in what kind of different, to really understand the gap here, I think we need to be provided with much more specificity around these numbers, Manager.
Yeah, and we have those numbers. I think it's a matter of how much information to provide and updates, and it seems like more is better, so I think we should put that in. Yeah.
I think, as we consider what our next move needs to be, it seems clear that identification of additional resources is probably the next step, but we can't really, I don't have any sense at this point of what the scale of that is.
And it is our intention, of course, at the conclusion of, I think, after a few weeks of this, to identify what those gaps are and to bring those forward and to find out whether or not it may be that we just need to redistribute or reallocate some of the resources to fill those gaps, or if we need to seek council approval for those gaps. But certainly it's our intention after this to do that type of analysis.
What's your timeline on that?
I'd have to talk to Lori because, a lot of it is we're still underway. It's week 3 of it. And right now we're focused on that third phase, which is sustainment and accountability. But we do intend, of course, to do an analysis of it.
And so as I look at these numbers, are those 79 individuals, where are they? Are some of them still outside the arch? Are some of them in shelter? And can you give us some sense of what that breakdown is? So we have 9 individuals housed, 2 reunited, and housed 13 in respite. Do we have about 102 who are still unhoused?
Sure. So
or is there some component of those who are in shelter now?
Mm-hmm. In terms of their physical location, so if they were in shelter or enrolled in programs, you would see them as, if they were housed, whatever the definition of that is, and I'm not sure, I can't speak to that because I think Lori would be better to speak to that.
Okay.
I will say that I do know, that as you can see, the population outside of the arch has shrunk dramatically since the cleanups occurred out there, and so I think there are some folks that were out in front of the arch that aren't anymore, and that connection to their service provision might have been impacted by the cleanups outside of the arch.
And so is it possible that some of the 79 are in shelter, or would they appear in that first category? And if these are just questions we need to ask of Lori, then that's
I can
fine.
tell you
just
for
help me
sure
understand
that,
kind of what the means of doing that is.
Sorry, I can tell you for sure that that is a question for Lori, but anyone that would have put in shelter would have hit our HMIS system, and we would have known that they were in shelter in another housing program. So if they're not identified as being in a housing program on this chart, then they're not in housing.
Okay.
But this doesn't call out to me whether or not they're in shelter. I'm assuming that if they're not in shelter, or maybe they are in shelter. I'm not sure. I think that's a good question for Lori.
All right. Thank you. And so we know at least in that area that we have probably a good number of individuals in need of immediate shelter. And certainly that's the case elsewhere throughout the city. And so I guess that brings me to my next question about the hotel option, which sounds like a very important one for our community. And again, unfortunately, I missed kind of the lead into this, and we'll have to go back to it. But can you, with regard to, I have some questions that probably are better for executive session, so I'll save those. But with regard to this particular property, are there any, I assume it probably has communal laundry. Does it have any kind of communal kitchens at this point?
So I think that's a good question for the city real estate office.
Absolutely, and every property is going to differ. With regard to this particular property, I don't believe that there is communal kitchen available, but every property is going to differ based on...
Yeah, I understand that.
Yeah,
that's why
but
I was asking about the one that we're making a decision about this week, potentially.
Yes, we can, and Alex Gill from Real Estate is here, and we can certainly get to those answers today, or if, council collectively has other questions specific to those properties, we can do it at another time as well.
And so, and I did have one more question. Where are the individuals who are now in respite? Where are they in respite? What are our respite options at this point?
I'd have to follow up with that response.
Okay, thank you. And so the part I'm not understanding completely, and I think you were addressing this, Mr. Mollica, as I came in. This week we have the decision before us to move forward and potentially purchase a property. What is the next step with regard to potential operations? Would there be an RFP? What are the steps for hiring someone to manage the project?
Sure. So, well, I won't speak. That's probably in terms of managing how will the transition of the hotel be managed, or how will we get services and operations to the hotel from a
Yeah, I'm really
fundraising
talking
perspective?
about, I assume our city staff would do the management of any kind of renovations that would be necessary in the actual transaction. What I'm trying to understand is what would be the process and what would be the timeline for the securing of an operator for that property and getting services in there.
So the question is about
The process and timeline for hiring somebody to operate the facility and also the provision of services.
Absolutely. So it's our intention, of course, that we do a long-term lease of the facility. ECHO has offered to stand up and do that lease arrangement with us. What we would do, of course, should council decide on Thursday to move forward with the motel, we would have a due diligence period for the procurement of that motel. And in the interim, then, of course, we would situate any type of long-term lease agreement or perhaps even operating services agreement. It's not unheard of. We've done that before with those other city facilities, nonprofits. And ECHO, at the beginning of this presentation, Matt had talked about, should it be ECHO, that he would then RFP for those direct services to be provided on site.
Okay, so our next step then would be to lease the property to someone, potentially ECHO. Is there a process for making that decision, or is it just the intention to lease it to ECHO?
Right now, it's the intention, because they have stepped up in a very big way with funding the operations and the maintenance of these facilities. We've not been approached by any other organization to do that.
I missed that important piece. So
Yes.
the funding of the ongoing operations would be a financial obligation that ECHO is prepared at this point to take on, or would
Yes.
you need to fundraise for it?
I mean, we would need to fundraise for it, but we're willing to do that. Yeah.
So what would be the time? What would be a time frame? What kind of time frame are you thinking of that you would have the funds necessary to operate it?
So I think that we would be looking at trying to raise those funds within the 60-day due diligence period, so that we'd be ready to operate as close to the end of those 60 days as possible.
And then what would be your expectations for fundraising? Would you try to fundraise for a 6-month period or a year period, or what?
For
what
2
would
years.
Be so you would undertake a campaign to fundraise for the maintenance and operations of this facility for a 2-year period before the due diligence?
So I believe that we
Is
need about
included.
a 2-year period of unrestricted funds to operate this before we can make it operational using other funds that exist in the community already. So if we turn it into a permanent supportive housing operation, and we're getting rent paid on those units. So until we start charging rent for units in a more like using housing vouchers or creating permanent supportive housing out of the space, I believe it'll take about 2 years. I think the community need is for this bridge sort of housing area for people to be in. And I think that we have a long-term need for that right now. And I think in 2 years, hopefully we'll have more hotels or more units for people to move into online. But I think we need to raise operating funds for any hotel that comes online with the assumption that we need 2 years before we can start to charge rent for those spaces.
Okay.
And then once we charge rent for those spaces, that will pay for the operating dollars to operate the space moving forward.
Okay, thank you. Thanks for those. Thanks for your participation in this. Manager, I want to really well understand kind of what the next steps are and what the arrangements are, and it's not terribly clear to me at this point to whom those questions should be directed. But I would ask that you maybe provide us with a memo, really spelling out what the arrangement would be, what the expectation would be in terms of timeline, and sort of whose responsibility it would be, and what the decision points for the policymakers are.
Leslie.
Thanks very much.
Yeah, thanks for staff and for ECHO's work on all of this. A lot of the questions that I had, Kathy has already addressed. But let me ask this. Will ECHO or the city be the lead in enrolling people at the motel and directing people to the motel?
Yeah, so ECHO will be the lead, but we'll work closely with the service providers in the community at establishing the referral pathways. Yeah, that'll be an important part of this.
And ECHO has been for how long the recipient of all of the HUD homelessness? Aren't you the grant recipient and the applicant?
We are.
ECHO
We're
is?
the lead, we're considered the continuum of care lead agency, and I believe it's been 13 years. I want to say but I'm new to Austin, so
Yeah.
I believe that's the
So
case.
13 years you've been the lead convener for the city. Sometimes when, not you, but ECHO has, sometimes when people talk about the work that we're doing in homeless for people who may be homeless, it sounds like the city is in charge of all of it, but in fact, really the flow of funds and the organizational chart, if you will, has ECHO kind of up at the top, but then lots of partnerships with the various different agencies and nonprofits throughout the city. Is that correct?
That's correct. I would say for the federal dollars, we are the lead agency for the federal funds. We are not the lead agency for the city contracts. So I want to be clear about that. Yeah.
But the city is a partner with ECHO
Of course.
in this larger organizational flow?
Yes. Yeah. Absolutely.
Okay. So last question on the motel. When will it open? Because I was thinking that this was something that would happen pretty quickly, assuming this is approved on Thursday. But then I got a little bit, then I started wondering about that when you talked about having 2 years worth of financing in order to operate it and manage it. Do
Sure.
we have any idea for when it would actually open?
Well, I mean, in terms of for this purpose, for people experiencing homelessness, I think my hope is that there's going to be a 60-day due diligence period that occurs where the city's getting inspections done, working with the owner to ensure that the purchase is a sound purchase and that there's not anything outstanding. I'm hoping that within that 60-day period, ECHO will be able to raise the funds to immediately to begin operations at the end of that 60-day period. I think the difficulty becomes not only do we have to raise the money, but we have to hire staff. We have to RFP out the service provision. So those things take some time. I think there will be a gap. There will be a period of time where we'll have access to the units, and some of the service provider, the people experiencing homelessness in the community that are already attached to service provision might be the right ones to access that space immediately, or we might be able to get some healthcare, like we might be able to stand up a clinic in the space with our healthcare for the homeless folks here in Austin. And I think there's going to be a patchwork and a mishmash of resources going into this initially until we're able to stand up and begin operations through hiring, getting people in place to do that work. So, and
Okay.
RFPing out the funds.
Okay.
So,
I did read an article in the paper today that there are some folks who found the tent that the state erected on the east side was actually kind of helpful in the frigid air that we got that was just untimely but seemed kind of randomly appropriate. So it made me wonder, because I know that we have not actually engaged in any real conversations with the state on what they are trying to do. Is that something that's on a to-do list, maybe?
Well, we've tried. I mean, we've certainly reached out to the state on several occasions without response. So I think I want to make sure that it's not that we've ignored their the work that's happening on that front.
So the non-responsiveness is more on them communicating back to your requests for
That's correct. Well, the
conversation.
Texas Homeless Network, which is the statewide organization that that is sort of the convener of all the continuums of care across the state, is at the Capitol now and trying to get a response from the governor's office. And they've been trying for this past week or more to try to get some response and get a meeting set up. And have been keeping in touch with ECHO as one of the COCs within the state that will be part of that conversation.
That's great. I think it's really heartening to see a lot of different efforts out there, and then if we can all just collaborate, even if it's only just a little bit, I think that's a real plus.
Sure.
And so then the second question I have been asked just in informal and various conversations by people in the community if there's a way that they can help. And they don't know themselves, when I talk with folks, exactly what that means to them. They don't know if the donation of how they help is time or money or resources. And I wasn't even sure who the single point of contact would be, because I know that ECHO is the lead convener of the work that we're doing in the community, but the city also has its own operations. But these would be people who want to either volunteer or make contributions, and the city isn't set up necessarily as nimbly as some other organizations. So should I refer folks to you or to Downtown Austin Alliance with their ATX Help initiative? Are we talking with ATX Help to kind of combine those efforts, and what sort of cross collaboration do we have there?
Sure. So the ATX Help group, to this point, we've had some discussions with them, but we have no official collaboration in place with ATX Help. As far as how to donate to different service provider organizations or how that would look, so typically, I think which is similar in most communities, you would get in touch with, say you wanted to make a donation to Caritas or to Integral Care or to Front Steps, you would get in touch with them and they would tell you what they need as an organization, how you can best support their efforts. ECHO, as a convener, there has been some discussion of being able to create on our website links to various organizations and their funding or sort of their campaigns for fundraising or campaigns for we need mittens, hats, gloves, boots, whatever the case may be, or this financially is we need to raise money for this initiative. And so I think ECHO's looking at putting something in place on our website that could navigate to other organizations to say this is how you donate to these different organizations and these different initiatives.
I think that would be really helpful, especially since people who generally are maybe just kind of engaging with this issue may not know about all the different organizations that are in town, so they
Sure.
wouldn't necessarily know to reach out. Or, by the same token, if I could remember the list and
Yeah.
I said it to them, that might also be overwhelming. But if I could say, go to ECHO, whatever your URL is, and that there would be on the main page a link to how you can engage and support and donate whatever it is you want to donate, then that might that would be really nicely organized.
Yeah, we have a partner list up, so that you can connect to our partners, but there's not a specific list saying this is how you can donate, these are the areas to donate to, or how you can donate to these organizations. So we're looking at building something like that out.
Okay.
Yeah.
And what is the address for y'all on the web? Is it echo.org?
It's atxecho.org.
atxecho.org.
Correct,
Okay,
yep.
thanks. Thank you.
Greg?
I just want to reemphasize a point that I think was early in the presentation. You know, there have been some folks that have taken the $8 million for the hotel and divided it by 81 or 82 and said that that's how many people get helped. But as you emphasized earlier, this most likely would help hundreds of households every single year, understanding that some people might stay there longer or even long term, and some people very short term. But I just wanted to make sure for folks watching that in the operation of these and other places, you would anticipate that there are folks that are coming in, getting stabilized, getting services, moving on to other types of housing, and so you could help hundreds of families per year. Is that right?
Yeah, I mean, I think yes, the belief is that this will help more than just the 80 plus. The units will help more than just one person a year in each unit. I think, like I said, we've seen in other cities, in other communities, average length of stays around 90 days in these areas in this sort of project type. I also think it's worth mentioning to that every year that somebody stays, every year that this hotel is in operation, you're continually cutting that cost in half. So if you say you house somebody for 2 years in this space, the cost to the city then becomes that number divided by 4 instead of 2 or 1. Does that make sense?
Right.
So if it costs $100,000 for 1 year, it only costs $50,000 for 2 years because you're not consistently paying $8 million a year for that space. So, if someone stays in that unit for 4 years, it's a quarter of the cost, the initial cost per door. That cost per door that you're paying for the unit doesn't change. It stays the same. You only pay it once. And so
Right, we would own that property
forever,
long term. So you're talking
yeah.
about years worth of help for
Yes,
lots of people.
correct, yeah.
Many years worth of help for hundreds of families, because within each room, in some cases, somebody might bring their spouse with them.
Yeah, I think it's not. We're not even sure. Like that's a great point. I think there may be scenarios where each unit is serving more than one person, and we can expect that to be the case.
And I appreciate manager and Rodney and everybody working on bringing this forward to us, and on potentially bringing more options like this in the coming weeks and months. I think that this really goes to show the continued strategy of housing folks and actually getting to the root cause of the issue. And I think we need to maintain focus as we turn the corner here in the community. I think more and more folks are coming to see how the city has actually helped house hundreds of people in just the last 60 days, how we can actually help hundreds more through action. And so I think that this provides a level of hope. It can be proof of concept that we can expand our efforts, and I think we just need to maintain focus as we turn the corner here.
Thank you for that. And we appreciate the questions. We know that this is a new strategy that we're employing. We'll certainly come forward with more details, especially responses to the questions that we've gotten here. We believe that it's a winning strategy, and it truly is going to turn the corner in how we address homelessness in our community. And just to be clear with the council, we are pursuing the motels as the strategy. We won't be pursuing the South Austin Housing Center. This is, as we've indicated, a more immediate response, and it's a true partnership between the city and its community partners, in that they're coming to the table with funding of their own. You've heard me say this repeatedly, that the city can't be the only funder of homelessness initiatives in our community, and I think that's where ECHO's coming forward with reaching out to philanthropists and other partners in the community to bring forward dollars.
Thank you. Ann.
Yes, thank you. So a couple of points that first off, I wanted to echo what Councilmember Tovo had said in terms of additional data with regards to what you're seeing with the Guided Path project. I'm excited about that project, and so I'm prepared to make sure that the council's role with regard to helping with resources, that we step up to the plate for that, because I think that the question about what is not matched due to lack of resources is something we need to drill down on and understand, and looking forward to a memo from you guys to tell us what in terms might be needed if there are additional resources needed. So there's that, as well as the memo about the additional details that Councilmember Tovo asked about, how this will be operated. Then I would say I am excited about the motel strategy. I know that when we first began talking about the South Austin Housing Center, there was an effort to locate motels, and at that time there wasn't one available to pursue. So I'm excited now that it looks like that's opening up. That, combined with the fact that the experience that ECHO and that Matt's bringing to the table, actually operating those, will be helpful. So I see, and I'm just kind of summing up what I think I'm hearing with regard to this strategy. This motel is part of a bigger strategy of looking into using motels as the best kind of physical resource for us meaning the city, to invest in, because it's actually more effective, more immediate, and a better use of dollars for the city. That there's a referral process, just as we've talked about before with regard to the South Austin Housing Center, that involves working with social service and ECHO and that kind of thing. And I would just add as an aside that I know we have to look at the appropriate process as you laid out in a range of things for referral, but I'm hoping that we're also looking at folks that may be staying in South Austin, because I think that was part of our thinking behind the South Austin Housing Center as being a resource for folks that are having to live outside in South Austin areas. And then, as the mayor mentioned, we already have in place in the ordinance an approach for addressing areas around shelters. So, and I think it's really exciting, the potential to have access to the units within that time period during which we're kicking the tires to purchase. Having access just to those rooms, understanding there needs to be a funding source for that. So to my mind, what this is doing is actually providing the path to more quickly and effectively, from a cost standpoint, doing what we've talked about with the South Austin Housing Center. So we're actually just have found a better location. And combine that better location with a path for future locations and looking at motels. So in that sense, I hear your recommendation to not go forward with the actual location along Ben White, and I support that. I agree with that because I'm understanding that what we're talking about with the motel strategy is the things that I just talked about. It's part of a larger strategy, and it is potentially available at some point for folks that are having to live outside in South Austin. Not all of it, but rooms may be available for those living outside. So, thank you.
I think that's. Did you want to respond?
No. I did want to. There was a question raised by Councilmember Poole about how individuals can help. I also wanted to add that in our website, we just recently built that out. That's austintexas.gov/homelessness. And there's a section for how our community can help out as well. And as you may recall, one of the things that Laura has done is convened an interagency communications convening of the city and its partner agencies. And we want to continue to support each other and to link to each other's websites so that way we can drive donations and drive more help towards each other.
Yeah. And I understand, too, when you do the comparative cost with the South Austin shelter, it was something like $140,000 a room, and this is just over half of that. So I like that we're finding a more cost-effective solution. And as you get into it and we start developing the policies and the plans for how we locate and identify who it is that goes into this motel or any of the other motels we have, if you could let the council know how we'll be prioritizing people or filling those spaces, that would be helpful. Thank you. Anything else for Matt on this? Go ahead.
One last thing, and it ties into what you just mentioned, Mayor, is that I'm also really excited about the guided path pilot. I see that as part of what we've talked about in terms of the encampment response strategy. So it's piloting as a first step a particular area in town to see how that works. And so you'll continue to keep us up to date on that. We've had conversations about the importance of taking that kind of approach in other parts of the city as well, including the area under Ben White, as well as there are many other areas in the city that need to be looked at. So I just want to keep that in mind, and I want to hear back when you're giving us more information on the status of this pilot, what y'all's thinking is about when we might be able to look at other areas. Thank you.
Thank you.
I had one last question about numbers. The Guided Path pilot started with 107 people. It's up to 126 people now. Are we continuing to add people into the Guided Path program?
I believe what it is it's those numbers, number of individuals enrolled, and the numbers not matched, which originally was 99. And now we're up to 102. So I believe that what we did was we added 3 more individuals to the list over last week. I can confirm with Laura.
So some of the numbers here are double counted?
No, they're not double counted at all. But those are the numbers that were contacted and we did outreach to originally was 99.
If I add up the numbers in column 1, 1028, it's 107. And if I add up the column numbers in 11.5, it's 111. And if I add them up in the third column, it's 126.
And
I'm just having trouble I'm just wondering.
There was no intention to add up the numbers at all. And what we may have to do is probably perhaps put a break in some of those rows to show the numbers that should be added up. It's not every single row.
Got it. So just going back to Kathy's point earlier, more detail and more understanding of what these numbers are, I think would be really, really helpful. Anything else for Matt before we let Matt go? Kathy?
Yeah, I don't know that it's really for Matt. It's a question for the manager, and it may be that it's better covered in one of the upcoming presentations. But I know that the Downtown Austin Community Court provided us all with some different, talked about some different scenarios, and then as I understand, they've also now provided some financial estimates, and I wanted to ask the manager, it sounds like one of the gaps we're facing with regard to individuals in the Guided Path Initiative is case management. And so, manager, I wanted to ask you what your process is for considering their proposal to do increased outreach. Remember, they had done a memo earlier this fall. I think there was a little confusion about it the last time we talked in the work session. They evaluated all of the options that were in 184 and then recommended the option of adding outreach teams, not extending the hours 24 hours or doing some of the other things that the council had suggested, but they did suggest and recommend adding outreach teams. So is that something that you are contemplating, and what would be the time frame for that?
Thank you, Councilmember. Absolutely, we're contemplating that. We're working with our homeless strategy officer to look at all the different proposals, including that are coming together to say how can we continue to make the right investments in the right strategies, and we'll be bringing that back to council. Again, I have the standing request if we need to do something immediate, I'll be requesting a special called meeting to make that happen. But really, we want to get our homeless strategy officer and the team to evaluate those different proposals.
And is that something that they're doing kind of right now? You know, because we did have the DAC kind of spent the summer getting us that information, and now they've done the cost estimate, and it sounds like we have an immediate need for case managers, and so I would just ask that be
Prioritized.
Yeah, that we prioritize. We have an immediate need. We now know what it would cost. We have a proposal for executing that. It would be great to know, whether that's going forward or not. And then who is the contact on your staff for more information about the motel option and what the relationship would be between the city and ECHO and other entities?
Yeah. The primary contact would be the Assistant City Manager, Rodney Gonzalez.
Okay. Great. Thank you. I didn't know if that was something public health was kind of on the ground working on, or if it was
At this stage.
Rodney. Okay, Rodney, I have lots of questions, as I indicated, so we'll be in touch. Thank you.
We're
And
gonna
again, I think this is a very good move. I don't know whether you talked about it earlier. It is in Councilmember Renteria's district, but it is just right over the border of mine, too. And so, I know that it's of interest generally, as well as to the whole community, about this path that we're embarking on.
Matt, thank you for being here this morning. Please thank your board for offering to step up in a real significant way to operate this. Thank you.
Thank
Rodney?
you. Mayor and Council, next we're going to have Ellen Richards, who is the Chief Strategy Officer from Integral Care, and Darylyn Cardona-Byler, who is the Director of Adult Behavioral Health Systems at Integral Care, present an overview of their agency's work. They are the local mental health authority. They're going to talk about their engagement, navigation, and housing of individuals experiencing homelessness.
Morning, Mayor, Council, staff. We appreciate the opportunity to be here and also appreciate your leadership in this area. And we have a deep partnership with the city and work with staff all across the city of Austin, and appreciate the good working relationship that we have. My name is Ellen Richards. I'm the Chief Strategy Officer for Integral Care, and Darylyn is here with me. She is our expert in housing and homelessness, and so when the questions get hard, she's going to be the one that answers them. Just a quick overview of Integral Care. We exist to meet the needs of people living with serious mental illness, substance use disorder, and intellectual and developmental disabilities in Travis County. And we are a governmental entity created by federal, state, and local laws in the 1960s. We're one of 39 centers across Texas. And we serve in two roles. We serve as the state designated authority for mental health and intellectual and developmental disabilities, and we are also a provider of direct services. And our Board of Trustees is appointed by the City of Austin, Central Health, and Travis County. As an authority, we have a lot of different roles that we play. And I'll go into some detail on the next slide as to those roles as they relate specifically to housing and homelessness. One of the things that we do as an authority is resource development, and we apply for funds and secure required match for funds to expand resources in our community. And through our intergovernmental agreements and contracts with the City of Austin and Travis County and Central Health, we secure the required match for all of the HUD vouchers that are received by HACA. And we also provide 100% match for the Forensic Assertive Community Treatment Team, which works with people who are experiencing homelessness, who also have significant engagement with the criminal justice system. So those are examples of how we use our authority role to bring additional resources to the community. We're eligible to apply for other state funds, and when the state has funds left over, we can often secure those funds for our community. Often these funds are not available to other organizations. Related to housing and homelessness specifically, one state grant we have provides more than $800,000 in support for the coordinated reentry system through ECHO, the Rathgaber Center for Women and Children, which will hopefully open very shortly, peer supports through Communities for Recovery, and services through Family Elder Care. As an authority, we also manage and we have a utilization management and fund management function for the community and for our areas of impact. We manage access to inpatient psychiatric hospital beds at ASH and those that are funded in the private system by Central Health for people who are unfunded. So when someone seeks care, they come through our system, our utilization management system, to access those hospital beds. Additionally, our utilization management team ensures that anyone seeking services through Integral Care meets our criteria, and we serve people based on diagnosis rather than economic need. And finally, one area that's worth mentioning, or three areas really, is planning, education, and training. We collaborate with the city and other key stakeholders to strengthen how our community addresses homelessness and housing access. For example, Darylyn serves on the Downtown Austin Community Court Board, and we also have a seat on the Membership Council of the COC. And those are just examples of the ways that we collaborate across the city to help in this area. We also train first responders, including APD and EMS, on how best to respond in a mental health crisis in order to avoid poor outcomes. And this obviously would include responding to individuals experiencing homelessness. And finally, we offer community-wide training to anyone in mental health first aid. And your staff here at City Hall and some of you in this room have taken advantage of that training. So as a provider, we provide a wide range of services, everything from navigation and 24/7 crisis response to integrated care, jail diversion, substance use treatment, prevention, and wellness. And we have a team of more than 100 staff who work in the area of housing and homelessness specifically. This diagram shows our work in the area. We have teams on the street every day working to do outreach and engagement, helping individuals to meet their basic needs, and making sure that they are assessed for housing. We also offer crisis respite when appropriate. Our next role is to help navigate individuals on a path to housing, which can mean access to short-term housing or shelter, conducting landlord outreach to identify available units, and providing employment services along with peer support and coaching. And when everything goes as planned, we move individuals into permanent supported housing and provide the rehabilitation supports necessary to achieve housing stability. And along the way, we provide the types of services and supports listed across the bottom, such as mental health and substance use disorder services. And just as an example, we use state funds to provide all of the clinical care at Community First Village and manage the on-site clinic for that community, in addition to the services we provide directly out of our clinical system. There's always a lot of questions about permanent supported housing. Y'all are talking a lot today about housing first, and so I wanted to use this diagram to try to explain where we fit in the continuum. Those of us in this room live in the yellow house on the right, and Integral Care works all the way at the opposite end of this spectrum or continuum, with the individuals that are experiencing the highest level of need and have the lowest level of resources and have the most barriers. So these are folks who are living with mental illness, substance use disorder. Many of them have a chronic disease as well. They often have criminal histories and other issues that keep them from accessing traditional housing programs. To meet the needs of all of the people in the community who are experiencing homelessness requires all of us working together in collaboration. And so while Integral Care is working down at the very far left, we collaborate closely with everybody in the community, such as Community First Village and Foundation Communities, HACA, Front Steps, anyone working in this space. We're all working together to try to fill the continuum of housing needs. Our biggest challenge as an agency is access to housing units due to the significant barriers our population faces. And currently, it's taking us about 3 months to move someone into housing. Our focus right now is on scaling our landlord outreach efforts to reduce that time to housing to 45 days. These charts show you our financial commitment in this area. The chart on the left, our total budget in homelessness and housing is $11,310,000. The red slice is the City of Austin investment. The majority of all of our funds, all of our budgeted funds, are used for clinical supports, and approximately 14% are for rental assistance. On the right, you can see the distribution of city funds. These are the funds that are invested with Integral Care, and the largest portion of these go to providing assertive community treatment team services, and I'll talk about those in a minute. The second largest area of support is to individuals living in permanent supported housing. So these are housing support services like rehabilitation supports. The next largest is for rapid rehousing services, and then host and rapid rehousing would be more around in the area of rental assistance, and then a homelessness outreach street team I think y'all are familiar with. And then finally, the purple and green pie slices are used for the match I mentioned earlier, for HUD vouchers, and the other is for PATH, which provides outreach and engagement directly to people on the streets. It's a state grant, and y'all provide the local match. There's a lot of numbers on this chart. I apologize. This is our data on, just kind of a snapshot of data on our homelessness and housing activities. I can give you a high-level overview of our service data. In FY19, we served almost 4,300 people experiencing homelessness out of a total of 30,000 people served. And then there's some time frame breakdowns that were requested by city staff that I think must align with some of the changes that have been happening over time. But you can see in different increments from January 1st till November 1st, January 1st to August 1st, and then August 1st to November 1st, who we've served that's homeless or has status unknown, and then the total served. The bottom chart shows individuals we are housing or working with to be housed. Today, we're supporting 561 people in housing who were formerly homeless, and we provide the appropriate supports to increase housing stability. Since January 1, we've housed 107 people. Since August 1st, we have housed 22 people, and we are in the process beginning this week of moving 50 people into Terrace at Oak Springs, our newly constructed housing community in District 1, and this will be completed by 12/31. And we have 64 people we are ready to move into housing. They have vouchers and case management support, and we are identifying available units at this time. So I wanted to go back and just talk to you a little bit about housing impact, and this relates to the program I mentioned earlier that's a city program called the Assertive Community Treatment Team, or ACT. The City of Austin secured the funding through the 1115 Medicaid waiver several years ago and contracted with Integral Care to implement this program. It focuses on individuals who are experiencing homelessness and who are also using significant numbers of public services. This data is from FY18, but we would expect the data for FY19 to be similar. So we did a look back to see what, how much service individuals were using prior to being in the program and then after 2 years of being in this program. And so I want to talk to you a little bit about the impact this program has had. So we tracked 3 areas: EMS calls, emergency room visits, and psychiatric admissions. So in the area of EMS 911 calls, so this is when EMS actually responded, we saw a reduction from 482 calls prior to services to 55 after 2 years. And if you average the cost of $831 per call, the savings over the 2 years was a minimum of $355,000. I got this kind of late, so I couldn't get it on the slide. And then with emergency room visits, the decrease was 891 to 117 after 2 years in the program. And the approximate cost of an emergency room visit is $1,400, and so that would be a savings of $1.08 million over the 2 years. And lastly, the reduction in psychiatric admissions was significant as well, both admissions and days in hospital. So we reduced admits from 113 to 21, and days from 3,300 days to 363. For a total savings of $1.4 million. So this is just a sample of the areas of savings that a program like this creates. Others include reduction in crisis service use, such as in our system, and then also interaction with law enforcement. So I think the city should be really proud of the investment they've made in this program and the significant impact that it's had on people. Both in terms of the quality of their life and the positive impact on public systems. And with that, I'll open it up to any questions or comments that you may have.
The results of what you're doing are real impressive, and I think we all know that. Thank you again for what you all do, and congratulations for opening up the new facility.
Thanks for being there with us.
All right. The work that you're doing, like on the last program that you talked about, the housing impact question, if you had more resources, would you be able to do more of that? Is there a limiting factor in that?
I think our limiting factor is the same as what you heard previously, and what I mentioned in the presentation is access to affordable housing units for the people that we serve. So if we had $1 more to put in, we would put it into creating affordable housing that can be used for permanent supported housing for people with significant barriers.
Okay. So our staff, as we heard this morning, is found 1 motel, is trying to find more motels, is trying to answer the question, how many motels should we be finding? Please, would you, I don't know if you're prepared to speak to that, or if we just need to make sure that you're layering into that analysis that our staff is doing to make sure that your numbers on need get rolled into what we see.
So we fully support We fully support the recommendation to move forward to purchase motels and create deeply affordable housing. It's really important for our community to have a continuum. And the plan you adopted had 5 areas that we, as a community and providers, came together that we said we were going to work to increase. The first one was, of course, the creation of affordable housing. The second area in that plan was ensuring that resources were in place to provide supportive services, understanding that the creation of housing alone will not end homelessness. We need to ensure that we have the supportive services in place. The other area was increase outreach and engagement, and I'm glad that Kathy Tovo is talking about increasing the resources on outreach and engagement, because that is an area of significance. And we also talked about ensuring that we have the ability to have access to immediate shelter and places for people to go. And I think that the strategy to use some of the resources to do the motels and that initiative and create bridge housing as we convert those into deeply affordable housing and permanent supportive housing really meet what we all as a community and what you voted that it was important for us to move forward as part of the plan.
Thank you. Anything else before we go on to the next section? Mayor Pro Tem and then Ann.
On page or slide 9, does that basically, the pie chart, is that saying essentially the county is not investing at all in homeless and housing?
Oh, no, that, it really was just intended to show you the city's investment. So the county has a small portion of funds in this area, but they invest in other things with our system. So the city and the county invest almost equally with integral care, but the county funds go to other types of programming.
Okay. Do you know, like, for example?
They support substance use disorder treatment, children's services, and do you know of other? Those are their 2 significant areas.
Okay.
As well as the mobile crisis outreach team.
And when it comes to the savings part you mentioned, is there a way to, and you don't have to answer this now, and if it's something that needs to be sent later, to understand, because I don't want to turn this into who's giving more and who's getting the savings part of it. But that being said, the city is really the focus of this extremely challenging topic when there's other governmental entities that help and maybe could help more. And so I'm just curious to know if there is a way to see, compare our investment to the savings, because I guess I would assume that some of the savings may not be seen on the city side as much as possibly other entities, as far as our jail, for example, our criminal justice system, for example. That is much more. And if we are able to house people, and the significant investment that the city is making with housing, and how that helps people, and the wraparound services provided by nonprofits, and how that can keep people out of the criminal justice pipeline, and that creates savings for the district attorney and the county attorney and the jail system. So is there, do you have info on the savings part more?
At this time, I wouldn't be able to speak to that specifically by entity. I think just broadly speaking, the savings that the city would be experiencing from this would be in reduced EMS utilization and reduced APD response. Tara, would you say are there other
But EMS
areas?
is also a shared cost with the county.
It is a shared cost, you're correct, but I would, yes.
That would be my assumption too, and fire, because fire makes medical calls
Yes,
as well.
fire as well.
We have the ability to provide that information. We will
Okay.
need
Sure.
need to explore and just go through our data to be able to provide that. I'd like to look at this just in terms of quality of life.
Yeah.
For the 115 individuals that this is impacting. If you imagine individuals using 3,301 days of hospital, and after being engaged in the program, only 363 days for 115 individuals. That is a significant improvement in quality of life. So I'd like to focus on that and the investment and their ability to engage with family, engage in the community, which is a huge win for our community as well.
Yeah, absolutely, and I understand having to take that broader, just as we are answering many questions about our investments, it'd be just helpful to know.
I'm happy to provide that
Okay,
information.
thank you.
And just to add, I will say, we have another program that I didn't bring data for called the Forensic Assertive Community Treatment Team for people with significant criminal justice involvement. And we're just now getting the first year of data for that program and starting to analyze that. So it's our desire to do deeper analysis on these programs so that we really can help the community understand their impact.
What was that called again?
It's called a FACT team, so
FACT team.
Forensic Assertive Community Treatment.
Okay, thank you.
So it's very similar to the ACT team. It just focuses on a population that has, these are folks with felony convictions and things like that.
Ann?
So I thank y'all for being here. This is very helpful to understand and wrap our minds around what you all are focusing on. So I had two questions. I wanted to understand a little better the numbers on page 10. So just so I can get some understanding of the scope of the folks that you are working with, the numbers. So I can see that for fiscal year 19, total served was around 29,000, but I'm not sure what number to look at for the total served that were homeless. Is that?
Yes. So for the fiscal year 2019, the total number of individuals served by integral care, house and unhoused, was 29,000, close to 30,000.
Okay.
And 4,293 of those individuals were experiencing homelessness.
Okay.
And
Okay.
just to provide some clarity around the numbers, currently in our system we have 2,524 individuals who are experiencing homelessness and are receiving services from our organization. This is aggregate data. However, many individuals come in and out of our services. So currently, the number to look at is 2,524 at this point in time.
Okay, thank you. How does that relate to what you all think of as the need? If you don't have those numbers now, that's fine, but it'd be interesting for me to understand. I'd like to understand what the scope is in terms of the folks that need jail service who are currently experiencing homelessness.
Our system has we have increased services to provide individuals services to individuals experiencing homelessness. 5 years ago, our system had 5 case managers dedicated to the work, and currently we have 130 case managers who are providing services, all from providing services under the bridges, camps, in our clinical support. The demand exceeds the number of staff who are able to provide the services. As an example, right now we're navigating 64 individuals who are still on the streets. Some of them may be at a respite. We were able to work 15 individuals, take them directly from the Guided Path program. 13 of those individuals, in addition to that, 13 were moved into our respite program. I think one of you had a question in terms of respite, so that was an integral care respite. And those individuals will continue to be navigated. But to Matt's point and what Ellen mentioned, it's difficult to find appropriate housing. We have a dedicated landlord outreach team that is out there meeting with landlords, developing relationships, and that is still a gap in our community. Our goal is to house individuals within 45 days of engagement, and currently we're at 3 months. So we have a lot of work to do there. So gap, I would say, is we need more affordable housing, and we need the supportive services, not only integral care, but across the system to be able to navigate individuals and support them in housing.
Okay, then I would just, at some point, if you could provide us with the scope of that. I understand those numbers change and there's some flux to them, but maybe some order of magnitude numbers that would help us understand if we were to able to locate additional dollars, either for housing or for services. What would that look like? In other words, in terms of what you need. So those are all my questions.
Okay, any other questions? Okay, thank you very much for joining us. Thank you for the work that you do.
I want to thank Integral Care as well, Ellen and Darylyn and David, for all the work that they do and for the results that they showed. I think it's a really good example of just how when partnered with community agencies like this, we can make a big difference in homelessness. Next, Director Ken
I think it also
Snipes.
is important to note that the one thing they said that they need and where they would next spend is to make sure that they had the housing
Absolutely.
in order to be able to provide the services.
Absolutely. Next, Director Ken Snipes is going to provide us a brief overview of encampment cleanup and storage, what we're doing, how we've increased services recently as well.
Thank you, A.S.M. Gonzalez. Good morning, Mayor, Mayor Pro Tem, council members, manager. My name is Ken Snipes, Director, Austin Resource Recovery. And today I'm here to talk about the work being done to clean up trash associated with homelessness. As you all know, a major complaint driver for our 311 center and many of our departments surrounds the trash and issues associated with it. But from my perspective, the fact that homeless people create trash is not the issue. In fact, we all generate trash. Nationally, the average for trash generation is about 4.5 pounds per person. Here in Texas, it's closer to 6.5 pounds per person. But I'm not here to talk about that today, and I hope to talk about that at another point here in the future with you about that. So, but the difference between those living unsheltered and those of us who live with shelter is simply trash removal services. And that's the purpose of today's topic. I want to begin by thanking all of the departments that are active and engaged in this effort. I have to tell you that I have been pleasantly surprised by the enthusiasm and the vigor with which they have all jumped in. In my experience, that has not always been the case doing this work. Their efforts are right now, I find them invaluable. And I would be remiss if I did not say that while our approach here may be new, the teams, the work that they're doing is not new. They've been doing this work for quite some time. They've been doing great work, and you'll see some evidence of that a little bit later in this presentation. And I think that's going to be the main reason that our pivot is going to be pretty easy going forward to our new approach. All right, so a little bit of background here. In an effort to more efficiently manage activities related to homelessness and the encampments, the city manager's office created a new vision for organizing activities related to homelessness. Under this vision, several new objectives or tasks were created. One of those objective areas, encampment cleanup and storage, was established specifically to address perceptions of blight associated with homelessness. The lead department for this objective is Austin Resource Recovery. An additional tasking associated within this objective area is to explore development of a program to store the personal effects of individuals experiencing homelessness. The overarching goal of the encampment cleanup storage team is to establish a unified response and to standardize protocols, methods, and procedures. So what have we been up to and what's going on? The activities that are being undertaken right now include underpass cleanup. That work is being done by Public Works, and they are currently cleaning 61 designated locations, and that's quite a bit. I have to tell you, that's quite a few locations that they're taking on. That's pretty impressive. Encampment cleanup is being performed by Public Works and Watershed Protection, and also Community Courts is doing some of that work as well. Bulky items are being taken care of by Austin Resource Recovery, and that is typically performed in conjunction with the encampment cleanups. Litter is being performed by Austin Resource Recovery. That work typically occurs nightly across the city. The Violet Bag Program also being performed by, picked up by, administered by the folks from Watersheds and a couple of others, and also picked up nightly by, or excuse me, now twice weekly by Austin Resource Recovery. Arch cleanup activities, that's a multi-agency effort, and as of last week, the decision has been made to perform that work weekly. Parks Department is also performing encampment abatement. They're also taking care of litter and trash on their properties, and they're doing work right now to find out or to get a better idea of how many people are actually living within the boundaries of their properties. And I talked a bit before about community courts who are also participating in the effort to clean up encampments. So changes. So what are we doing differently? What are some of the changes that we're taking on right now? The city manager created an encampment cleanup and storage tasking. I mentioned that. The Violet Bag Program is now administered twice weekly. That's happening on Tuesdays and Fridays. It was prior to that, it was happening once per week. The overpass and underpass cleanup work is happening twice monthly. That was happening once a month. Again, the arch cleanup work is now going forward, going to be taking place weekly. An inspection element was also created. And the purpose of the inspection element is to start to transition us into a more proactive approach instead of a reactive approach. So instead of what we've kind of done is we've operated solely on a schedule and on a complaint-based type of operation. And now we're moving into a more proactive approach. And we've also developed tools, and we'll hear a little bit about that here shortly. So just in the short amount of time since we've made the pivot, we're seeing some changes here. And one of those that I'd like to call attention to is so far we're seeing a downward trend, if you can call 2 months a trend. But we're seeing a downward trend in the amount of calls coming into 311. That's a stat that I'll pay particular attention to going forward. As we start to do more and more of this work, we'll hope to see that come down even more. The arch cleanup, again, I mentioned that that work, and the last cleanup took place on November 5th. The team removed 3,260 pounds, or just over 1.5 tons of debris, litter, and trash. And I want to highlight some of the work that's being done, again, by Watershed Protection with their removal work, and then also Public Works. But Watershed Protection conducted 37 cleanups across 11 sites between the months of March through September, and they removed 24 tons of debris and litter. They engaged 400 people during those activities. 152 received outreach services. 21 people were connected with the Other Ones Foundation. And with respect to Public Works, they are currently, as I mentioned before, servicing 61 sites. And from the months of August through October, they've collected 54.4 tons of material. One of the other major achievements here recently from the working group was to define and develop a definition of personal items. Now, I can tell you that in my experience in this work, this has been a major risk area for the agencies, and that's why we decided to tackle this area first. I'm not going to read the entire definition. Again, this is a testament to a lot of the work that had already been done by the teams here, so we were able to pull this together pretty quickly by making some changes. And the goal here is to create a citywide definition for personal property. And if I could, I just want to read the first sentence here. Personal property is an item that is reasonably recognizable as belonging to a person, has apparent utility in its present condition and circumstances, and does not pose a health and safety risk or potential health and safety risk, which includes any item that poses an environmental or a fire risk, a potential environmental or fire risk. Examples include personal property, but are not limited to, and it goes on to talk about personal papers, documents, tarps, radios, electronics, identification, so forth and so on. So I think this is a major achievement for the team here, and more work like this to come here soon. So next, I want to talk about work to be done, which is the development of a citywide procedures, protocols document, and some additional tools. Public Works has done a great bit of work here. We'll see that in just a bit on development of protocol and procedures. And then Watersheds has done an amazing job with an assessment tool, which I think is a really critical tool for displaying the fact that these cleanups don't happen without some sort of acknowledgement that there's a criteria, and we're not just moving people just because, or going in because we need to move people. We're not doing that indiscriminately. And so really quickly, I know that's a little bit difficult to see there, but what I wanted to do, this is page 1 and page 5 from the Public Works document here. And I want to call out the fact that it starts out with the purpose, the definition, very similar to what we just looked at. And it goes on to highlight things like the unattended property, and those kinds of things, which are really, really key, because we want to make sure that we don't throw people's things away just because they're not present when the teams show up to do work. And then secondary to that, on the second or fifth page, I want to call out the fact that one of the provisions here is to connect people with services, whether it be through EMS or Integral Care or any of the other service providers, as part of these efforts that take place as we go forward. And then the last document here is a snapshot of the assessment tool that kind of displays the work that Watersheds does as they go forward and issues within their boundaries. And what we'll do here is the same. We'll adopt similar documentation for an assessment criteria before we move people to determine whether they're a hazard either to themselves, to someone else, or creating a general hazard for the city. And as I wrap up here, I just want to say that the purpose of this work and this effort is to clean up trash, to protect public health and the environment. It signals a departure from the reactive approach and a transition to a more proactive approach. People creating trash is not the problem. Not having an outlet for disposing of their trash is the problem. Questions?
Questions? How is your cleanup operating at the same time or conjunction with what the state's doing?
We're in the process of assessing. The state has determined that they will service 17 areas, and we're aligning the work that we're doing with the work that they're doing. And so they're putting out a schedule, and we obviously won't service the areas that they're servicing on the same days that they're servicing those areas. So there's some areas that we've serviced. We're moving to service twice a month, and we'll probably service those areas on an off schedule from the state's work. So, Richard, do you want to speak to that?
Mr. Mayor, and City Councilman Richard Mendoza, Public Works Director. Yes, we've been in almost daily communication with Mr. Mike Ariano with TxDOT. He's the district maintenance director. And what we've been able to do is share each other's schedules so that there's no overlap or any conflicts between those crews that do occur. He's also shared with us some calls that they received on areas that they do not intend to service, so that we could overlay those with our planned service areas so that we may be able to increase our frequency there. So the coordination effort is ongoing and has been on a daily basis.
Okay, thank you. Greg.
I'd like to thank both of you directors and your departments for creating that definition of personal property. I think that that's really important and hard work to do so that you can focus on addressing litter issues while respecting and recognizing that we don't want folks to lose their IDs or their wheelchair or their crutches or the small tents that keeps them warm under the bridge while we try our very best to get them into the housing options we talked about earlier today. So thank you all for that work.
Kathy.
Echo my colleagues' thanks. Quick question with regard to the outreach that you've described on page, let's see. Well, I'm not sure what page. The one where you had different stats under results and associated information. You engaged with 400 people, 152 received outreach services. Can you let us know what outreach services? Were these from Integral Care primarily? Were they from other entities? Who were the outreach services who were delivering?
I'm not sure at this point. I can get that information for you. I've been told that it's a variety of services depending on the individual need, whether it was mental health services or medical services, so a variety of services.
Thank you. And I saw another reference later to within the Public Works Department policies and procedures, 5.2.1, an expectation that Public Works would coordinate with EMS, Community Court, Integral Care to provide health checks and other services. And I guess I'm wondering kind of how often does that happen each and every time there's a cleanup? Are the outreach workers going out first? Like what's the actual process for delivering those services, those outreach services during a cleanup?
Councilmember, our practice has been to engage those outreach services 3 days prior to the actual scheduled cleanup. So they will actually visit those sites the 3 days in advance to assess the population for any needed services. And that's the same process that we mirrored when TxDOT formerly did this work, and it seems to be the optimum practice.
So they go out, they visit the I'm sorry, you look like you were going to add.
And that would be the same approach that we would look to mirror citywide, regardless of who's doing the work going forward.
Thank you. And so the outreach workers go out about 3 days earlier. They interact with individuals, talk to them about, and try to assess need, let them know the cleanup is happening, hand out the bags, and I assume provide some education around separating their personal property from things they might want collected. And then in terms of medical services and other things, are those being provided during the time of the cleanup? There was some language in your policies and procedures that suggests there are actually services or additional outreach going on during the times of the cleanup as well. So are those same individuals, the same outreach workers coming back 3 days later alongside the actual cleaning?
They are, and it is basically on an as-needed basis. So they're in constant communications with our crews and our contractors. If there are additional needs that we recognize need to be addressed on the actual cleanup day, we'll solicit and engage those resources.
Are you also engaging with like the street med teams and some of the other services that are out there?
Councilmember, I'll have to poll my crews and my managers to see what other resources outside what we have in our procedures that we're accessing.
Great.
I'm not familiar with street med usage either.
Councilmember Kitchen may remember. I'm not getting their name quite right. It's Central Health's street team. Their street.
You know what?
Wasn't PATH? That might
No,
be another
PATH is
option,
Integral
but
Care.
I thought we had. I'll get the name for you and make
I'm
sure
sorry,
that,
I'm not
that to
remembering
the
it.
extent that there, are other services being delivered in Austin, that would be good to bring into this process. I think we should engage them.
Yes, Councilmember, and I was just informed that we are utilizing Integral Care as our single point of access, and they may be reaching out to these additional resources as needed.
Thank you.
Anybody else on this? Yes, Allison.
added and all the work. For the definition, I was wondering to what degree will TxDOT agree to operate with the same definition?
Well, it's my understanding they have been to some degree. We can ask that question specifically and see where they may differ, but we haven't done that yet.
I think a lot of work went into creating this definition, and if this is a definition that we as the city want to adopt, then at the very least we should be providing that to TxDOT and encouraging them to respect the same definition that we put forward. I don't know exactly how those relationships are evolving, but I would just encourage that we make those efforts as well. I wanted to drill a little bit down into the comments that you made about PARD, because some of the information's on here and some of it's not. So can you speak a little bit to how ARR is supporting PARD, or some of the other units are supporting PARD in their cleanup needs beyond the Other Ones Foundation?
We're just starting those conversations. The team has met 3 times now. We meet every Wednesday. And so one of the discussions is the opportunity to connect with some of the other departments and understand their needs. One of the conversations that we have with Kimberly's here, with Parks was just how we could support them as they start to understand the needs on their property. So, Kimberly?
So I concur with what Mr. Snipes said. I would say that we have our own point-in-time count that's happening on this Friday, where we're going to be going out in teams to try to assess exactly where all of the different encampments are. We have a system by which we rate those camps as to the priority in which we will do cleanups, health and safety issues obviously being a priority, but I can tell you that there's more than our team can keep up with, which means that unfortunately or fortunately, I guess depends on how you look at it, those camps stay intact until we have an opportunity to be able to give the appropriate notice. But we do visit each of them, or all the ones that we are aware of. And we make sure that we tell people what the rules are, that they're not supposed to be in parks. We also help them understand what give them bags and those sharps containers like we talked about before, to make sure that they're keeping their encampments clean. And then we give them an approximate time frame by which we would be back. And we also engage Integral Care to help us. And I think one of our issues is that everybody here is engaging Integral Care, so they also have a resource and a capacity of a certain number. And so we work with them to make sure that somebody from their agency can visit before we actually move them out. So we'll have more information about maybe additional resources that we need. The Other Ones Foundation has been engaged and continues to help us as much as we're identifying these locations. But we have a little more work to do to give you a few more metrics by which to understand exactly what it looks like in the park system.
Great, thank you. I'd really appreciate having that better picture. It sounds like the point-in-time count will be a good next step for getting that data. You kind of answered this question, but I just wanted to see if you wanted to add anything more about the kind of services that you're connecting folks up with. You discussed Integral Care, but I didn't know if you had anything else you wanted to add.
That is our go-to, and they help us understand. Our team, the team who has been working on these issues for a long time, they actually they can tell you the exact services. I cannot. But it's through Integral Care that there's the connection.
Yeah, and I know there's been a lot of care to try to do that, and I've been talking with that team off and on over the last several months. I appreciate the efforts that are being made. Thank you.
I didn't know you were doing a point-in-time count. It's your own census, which I think is a great thing. You have to have that information so we can get a feel for the scale of the challenge that we're looking at. Has PARD done that kind of census count before outside of the ECHO point-in-time account?
Not to my knowledge. And the issue that we've determined, or not an issue, but the thing that we found is that the ECHO point-in-time count is very helpful, but it doesn't go far into the park system. So this is, boots on the ground hiking to be able to see exactly where encampments might be. Because there's one thing to do a point-in-time count when you drive around the parking lot of a park, and it's another thing to actually camp or hike back into locations. And so that's what our point-in-time count, that's how it's going to differ a little bit from the January count. And that's not to discount what happened in January. It's just to help us have a better understanding of what's happening in our system.
No, and I think the better understanding is great. I know that ECHO also does some boots on the ground, diving into areas as well, but they might not be doing their boots on the ground diving into areas that are the parks areas. I'd be interested in knowing, when you report back that number, if you could also take a look at the last ECHO point-in-time count, which identified where it was that they were finding people, to see and let us know if there are undercounts last January that you would be aware of based on what you're finding. Obviously, we don't know whether they existed on January, but a lot of these camps get started and then they just get maintained until somebody moves them. But if you would look back at that other report and tell us what you can see as compared to that, that would be helpful.
Yes, sir.
Thank you. Allison.
I just was wondering if you need volunteers for Friday or if you're just using staff.
We're just using our staff.
Okay.
But that's a great idea for the future. Thank you.
Okay, because I think there would be a lot of people who would be willing to come and volunteer, and we're hearing, from a lot of people that they want to find ways to engage, and I know we have lots of people who have in the past participated in the January point in time, and we might be able to leverage some of those folks as well.
Not a bad time to mention that coming up in January, we'll have that point-in-time count again, and to participate, there's a training. You just don't show up on the day to do it, which might be something you take a look at. If you ever pulled in volunteers to actually train people for being able to successfully participate in that kind of census. But I'm sure there'll be a lot more publicity as we get closer to those training opportunities citywide for the ECHO point-in-time count. Kathy.
And I just wanted to follow up on my question earlier and clarify. It's community care, I believe, has the street medicine teams, and just wanted to suggest that they might be good to engage in this. And then also there was a federal grant provided that I think is being utilized by Dell Medical School, Community Care and Integral Care for additional street medicine teams. I'm not sure whether they're replacing the other street medicine teams or just kind of a more interdisciplinary, but it seems like good if they're, to the extent that community care and the Dell Medical collaboration is not involved, they might be good to engage.
Thank you, Councilmember.
Thank you.
Okay. Pio.
While we're on the subject of counting, I would be very interesting to see how many people are camping out in our watershed. I know that I visit the one in Montopolis, and I've seen that they have quite a few camps there. So I'd be very interested to find out how many people are camping out there.
Okay.
Just as we conclude this piece of the presentation, as you heard, departments are doing great work and always have been doing a lot of work regarding cleanups around encampments, but the change that we're seeing now is really a coordinated and standard effort across the enterprise, and I just want to thank Director Snipes for really leading that effort, so thank you very much.
Thank you. Thank you. Rodney.
Mayor and Council, so that was the last presentation, but as I mentioned at the beginning of this briefing, we do have our priority area leads from communications, housing, public safety, homelessness services, and of course cleanup and storage here to answer any general questions that you may have of any of those priority areas. I know that there was a question about the dashboard. It's my understanding that it is in design, and we do have Laura Foss here. We certainly are, we want to take council input as to your thoughts of like what a dashboard looks like and means as we are designing that dashboard out. But all of our priority area leads are here for any general questions that you may have.
Well, with respect to communications, Laura, we talked about that before. I think something as in a dashboard so you can compare over time would be really helpful. But I think that there's a lot more data and numbers. The things that would be really interesting for me would be to understand the numbers associated with the population that we have. So understanding, so people can go there and understand the difference between the 2255 number and the 7500 number. The 7500 number actually seems to be a more perhaps a number that we need to spend a lot more time talking about than the 2255, because it shows us over the course of the year. And if we're dealing with 7,500 people, we would know over time if that number is going down or it's going up. Knowing that what we're housing and exiting people from homelessness, but having details to those numbers, not conflating a lot of categories, because it's really hard to know what to do when we conflate, when we I said it's conflating numbers as opposed to pulling those out, I think would be really helpful. And then with respect to housing and shelter, the number that is in our inventory at any point in time that we own, that we're renting, that we're using vouchers with, and having that by type, what we own, apartments, houses, so we know if we're going to be moving toward that. Might also be helpful to know what the balance of the risk fund was that we used to lower the barriers for landlords helping, so that we can monitor that and see what, if any, kind of claims are being made against it, but just so that we can point out to landlords what those possibilities are. And I would also think that the sooner we can get this up, the better, so that the community has a feel for what it is that we're doing right now, because I think a lot of the community does not. And I think that being able to track it along with us to see that there's forward progress and movement, if there is, and certainly to know if the opposite is true, so that the community can get more engaged that way, and we can increase the measure of hopefulness that is in the community. Anything else? Thank you. Does anybody want any other project lead come up here before we go to Land Development Code? All right. Thank you very much, Rodney. Thank you.